When people talk about living longer, they usually focus on things like cholesterol, blood pressure, sugar, or weight. But there is another number that deserves much more attention: VO2 max. This is basically a measure of how well your body can take in oxygen, move it through the heart and lungs, and use it during exercise. In simple terms, it is one of the best overall markers of your cardiorespiratory fitness. The gold standard way to measure it is by formal exercise testing, though many watches and apps only estimate it. And here is why that matters. The data consistently shows that people with higher cardiorespiratory fitness tend to live longer and have lower risk of cardiovascular death. This is not just about athletes. This pattern shows up again and again in large studies and major reviews. In one very large cohort, lower fitness was associated with a mortality risk that was comparable to, or even worse than, some traditional risk factors, and the best survival was seen in the fittest groups. So the message is not, you need to become an endurance athlete. The message is, low fitness is a real health risk and improving it matters. That is the key point most people should take away. Now, what exactly is VO2 max telling us? It is not just a lung number. It reflects how well your heart pumps, how well blood carries oxygen, how well your blood vessels respond, and how well your muscles use that oxygen. So when VO2 max is low, it can be a signal that the whole oxygen delivery and usage system is not functioning as well as it could. Another important point: the relationship with longevity appears to be dose-related. In other words, as fitness improves, risk generally comes down. Large evidence reviews report that each 1 MET increase in fitness, which is about 3.5 milliliters per kilogram per minute, is associated with a meaningful reduction in all-cause mortality. Across meta-analyses, that reduction is often in the range of about 11% to 17%. But this does not mean you need to chase perfection. For most people, the biggest real-world benefit comes from escaping the low fitness zone. Going from very unfit to moderately fit may matter more than going from already fit to extremely fit. That said, very high fitness levels have also been linked with excellent survival, and major cohort data did not find a clear upper limit where benefits suddenly disappeared. There is another reason this topic is powerful. Fitness can sometimes tell us more than body weight alone. Recent meta-analysis data shows that people who are fit often do much better than people who are unfit, even when body weight is higher. That does not mean weight is irrelevant. But it does mean that being heavier and fit may carry less risk than being lean and very unfit. So, fitness is not a side issue. It is central to risk. So, how do you improve VO2 max? You do not need a lab. You improve it by improving your cardiorespiratory fitness. That means regular aerobic work such as brisk walking, cycling, jogging, swimming, incline walking, or similar activity that makes your heart and lungs work harder. Official physical activity guidance remains a very practical starting point. At least 150 to 300 minutes of moderate intensity activity per week, or 75 to 150 minutes of vigorous activity plus muscle strengthening work at least 2 days a week. In other words, aerobic activity improves cardiorespiratory fitness, and more vigorous work can often improve it faster if it is appropriate for the person. For some people, intervals can help as well. For others, simply going from sedentary living to regular brisk walking is already a major step forward. The exact method matters less than the fact that you are consistently challenging your current level. And one caution: if you have chest pain, unexplained breathlessness, known heart disease, or major risk factors and want to start vigorous training, it is sensible to speak with a clinician first, because the goal is not just to exercise harder, the goal is to improve fitness safely. So, here is the bottom line. VO2 max is not just a sports metric, it is one of the clearest windows into how well your heart, lungs, circulation, and muscles work together, and the data strongly suggests that better cardiorespiratory fitness is linked to better survival. So if you want one of the most meaningful long-term health targets, do not just ask, "What is my weight?" Also ask, "How fit is my cardiovascular system actually becoming?" Because when it comes to longevity, fitness is not just about performance, it is about survival. Click the subscribe button to follow Cardio Decoded MD for simple evidence-based explanations of what heart research and health numbers actually mean for your life.